I really want to share just a little bit of my research. As Fiona said this morning, that we're looking for some answers. You're certainly not going to get that from my research. You're probably going to get a whole load of questions. But certainly wanting to think a bit more broadly about adversity in childhood, so not just the sort of 10 standard adverse childhood experiences that are included in the ACEs research as we know it, and also to start thinking about gender and how gender and adversity in the system might interact. Okay, where is this? So my name is Nina Vaswani. I'm the Research Fellow at the Centre for Youth and Criminal Justice. The Centre is a national centre aimed at supporting policy and practice in youth justice. We're primarily funded by the Scottish Government, so thank you very much, Scottish Government colleagues. And we really exist, as I said, to develop policy and practice. We do this by three different activities through practice development. So the bulk of our centre is made up by practitioners with very recent practice experience, predominantly social work, but also psychology, law, for example. And we use that because we bring in current practice knowledge, but we give practitioners the time and the space to really think about practice and practice developments and to share that back with peers. Then I head up the research strand, and I'm going to share some of our research with you today. And that is we often undertake primary research, which I'm going to share, but we also do sort of summaries, research summaries, and help busy practitioners absorb the evidence and use the evidence in their practice. And so we have a knowledge exchange team that really help bring all of these different experiences, so bring policy, bring lived experience, bring research and practice wisdom together. So that's really CYCJ in a nutshell. As I said, I'm going to focus very much on some of the emerging research that we have. So we had a particular interest in adverse childhood experiences, primarily because, as you may have seen from the previous slide, we want to ensure that children in Scotland flourish. We want to ensure that every child has the best childhood possible and goes on to achieve the best outcomes. But we are also interested in adverse childhood experiences from a justice perspective. This is quite small. Eyesight is not that good, but this is from the Welsh study, and this is from the 2015 study, which suggested that actually if we can prevent ACEs, we can reduce violence victimisation by 57%. We can reduce violence perpetration by 60%, and we can reduce lifetime incarceration by 65%. So there is a massive justice interest in understanding and preventing adverse childhood experiences. So I think Kat touched on some of this earlier, but in England, people who had 4 or more ACEs were 7 times more likely to be a victim of violence, 8 times more likely to be a perpetrator, and 11 times more likely to have been incarcerated. And in Wales, the findings were even more striking. So 14% of those with 4 or more ACEs were more likely to be a victim of violence, 15 times more likely to be a perpetrator, and 20 times more likely to be incarcerated. So when we looked at our study, we did a study of 130 children who had been referred to our Interventions for Vulnerable Youth Service, our IV service. Now this is a national service that exists to support practitioners with young people who are displaying very, very at-risk behaviours. So these are behaviours that mean that these young people are at serious risk of harm to other people and also at serious risk of harm to themselves. So behaviours such as serious violence, harmful sexual behaviour, and at times extremist behaviours as well. So this is a study that looks at children's childhood experiences while they're still children, and that's an important limitation. So these children were aged between 12 and 18. There was one 11-year-old that snuck in, but they shouldn't have really been there. So their childhoods are not yet complete necessarily, so we don't know the full extent of what their experiences will be. It's a really small sample, thankfully, because these are our most worrying children, that it is a small sample. But it does mean, in terms of the adverse childhood experiences research in general, it's just, it doesn't really touch on some of the big nationally representative samples or some of the American ones that have 64,000 participants, if you can call them participants, in their research. It also was a case file review, so we didn't speak to young people directly about their experiences, and that's probably quite an important limitation. So we also looked at then the 10 adverse childhood experiences, plus we looked at childhood bereavement, which is something I want to discuss a little bit today. And then we looked at a range of key health and social outcomes for the young person. So we looked at alcohol use, drug use, serious violence, harmful sexual behaviour, experience of secure care or custody, and school exclusion. So I'm going to present the findings from this research, bring in some of the research that I have conducted on childhood bereavement. But as I said, with a sample this small, we're probably posing more questions than we are answering. So this graph, I don't know if you can read it from a distance, but this is summarising some of the key adverse childhood experience research that you've heard about today. I'm not going to dwell on the background to it, as I think you're all here because you know and understand this already. But the inner ring there is the original Felitti study. The middle ring is the English ACEs study, and the outer ring is the 2015 Welsh study. So you can see with them, on average, around half of the population have experienced one or more ACEs. It does differ slightly between the studies. So when we looked at our 130 young people, this graph gets smaller and smaller, you can see a marked difference. So actually only 7% of our sample had not been exposed to one of those adverse childhood experiences. And again, there are probably limitations with a case file review because we were basing our data on what professionals knew about that child's experience or what they brought to the table at the discussion. So in the Welsh study, where 14% of people had experienced 4 or more ACEs, which is huge, that's about 1 in 7 of the population, we found that 59% of our young people had experienced 4 or more ACEs. And if you remember, these children haven't reached 18 yet, so they have potentially other ACEs that they will be exposed to. Okay. When we look at the individual ACE exposure, so the grey bars there are our sample, the blue bars are the Welsh study. You can see the huge levels of adversity in that population. So the most common experience was that of parental separation, where 81% of our participants had experienced parental separation, and 61% had witnessed domestic violence. So really huge levels of adversity. 50% had experienced emotional neglect. So for me, the theme of loss and separation is really striking in these findings, and that's something I do want to return to. So parental separation, family incarceration, so 1 in 4 had experienced the imprisonment of a family member. There are other experiences that aren't measured here, so 3/4 of our sample were living away from their biological parents for whatever reason, and whether that was a formal care arrangement or an informal arrangement. And obviously bereavement isn't captured in this traditional study, as it is in the traditional studies. So as you've heard today, there is this strong relationship between increasing exposure to adversity and negative outcomes later in life. So in our sample, our pattern looked a little bit like this. We did not find that dose-response relationship, but there are many reasons, I think, behind that. It is a very, very small sample. It is a very, very skewed sample. It's a very unusual sample. So you have to have experienced many negative outcomes before you can even be considered eligible for referral to our service. So in our sample, we certainly didn't find that. I suppose I want to talk a little bit about the limitations of ACEs before we go into what I think might be some of the missing ACEs. I'm not going to dwell on it too much. I think that the ACEs research and the ACEs framework provides a really, really powerful public health message. And it is really important in raising public awareness of this link between adversity and negative outcomes later in life. I also think I live in a bit of a bubble because a bit of me, I heard somebody talking earlier about, well, we've known this for a while, this is what we've always known, and this is what we do. And I kind of believed that, but then I realised I live in this bubble where actually we may know this already, and we may have been working in this sort of field for a long time, but it isn't known necessarily in all disciplines or across the wider workforce. I was at Social Work Scotland conference last week and a little bit surprised when Suzanne Zedike asked who had heard about the ACEs research and asked people to put their hands up, and the amount of people who put their hands up to say that they hadn't heard about the research. And this is a conference predominantly attended by social work managers. And I know that not everyone necessarily works in children and families, but we've heard about that impact on later life experiences and homelessness and criminal justice and substance misuse. So I was very surprised. So I think you shouldn't underestimate the importance of having a really powerful message about the link between adversity and poor outcomes. So I'm fully on board with ACEs research. That's why we undertook our own. But I do think as professionals, we do need to be mindful of the limitations of this adverse childhood experiences framework. So it is a simplistic measure. There was a debate before lunch about the ACEs score and whether that was enough. I personally feel it's probably not. You can have an ACE score of 1 and be hugely traumatised by your childhood experiences. You can have an ACE score of 3 and not necessarily be affected by that. There was talk about parental separation. Parental separation could be a hugely positive experience in a child's life, particularly if that parental relationship had involved abuse or domestic violence, for example. So I personally would say we need to be very wary about boiling people's experiences down to an ACE score. But in terms of raising public awareness and making sure that the workforce fully understands about that impact of adversity on people's lives, then yes, it's absolutely useful. One of the other things is really about whether there are missing adverse childhood experiences. And one of them that I am interested in is bereavement. So people who might be familiar with my research will know that that's been the main focus of what I've been interested in. So I'll go to talk about that a little bit. So I first became interested in bereavement when I was working in Glasgow at the time, managing the Youth Justice Research team there, and we had 252 persistent offenders. Now this was 12 years ago. These were children aged between 8 and 16 who had been referred to the Children's Reporter for 5 offending episodes or more in a space of 6 months. And government policy at the time was very much focused on reducing these persistent offenders. It's certainly not a term that we would use nowadays, but that's where we were. And we found in Glasgow that our persistent offenders were on the increase. So I trawled through all 252 case files to find out what had been going on in these children's lives and how could we better meet their needs. And what stood out was that bereavement cropped up time and time again. So when I looked into it in a bit more detail, I found that 59% of these children had experienced a significant bereavement by the age of 16. But childhood bereavement is unfortunately a common experience, and research in the general adolescent population would suggest that between 43 and 78% of children had experienced a significant bereavement by the time they are 16. So our sample wasn't that unusual. It was right smack in the middle of that range. But what we did find was that the nature of that bereavement differed markedly. So multiple bereavements occurred in the sample. Traumatic bereavement, so bereavements caused by murder, caused by suicide, caused by overdose, for example. That doesn't mean the child experienced that bereavement as traumatic, but the research suggests these are more difficult or can be more difficult bereavements to deal with. And parental deaths were high. So in the general adolescent population, between 3 and 5% of children are estimated to lose one parent by the age of 16. 1 in 5 of our sample had lost one parent, and some of them had lost more, but both parents. So really, I began to think about, is bereavement a particular issue in relation to offending behaviour in some way? So I went on to look at the experiences of young men who were in Pullman Young Offenders Institution. And actually we found that 91% of the young men there had experienced a significant bereavement. So these were young men under the age of 21. We found that 2/3 had experienced 4 or more bereavements. And in the adverse childhood experiences research, 4 is a really important cutoff in terms of negative outcomes. That's also the same when it comes to multiple bereavements. So at that point, research would suggest that the risk of negative outcomes is significantly increased at 4 bereavements. And then 77%, so more than 3/4 of those young men in Pullman had experienced a traumatic bereavement, and many of them had experienced multiple traumatic bereavements. So I suppose I asked the question, why is bereavement not an adverse childhood experience? And actually, when we included bereavement in our ACEs study, it increased the mean adverse childhood experience from just under 4 to just over 4. Okay. It's not just about bereavement though. So Bowlby, in his work on separation and attachment, really acknowledged that the vast majority of losses in society do not arise as a result of death. And so actually I think when you look at that ACEs framework and the 10 ACEs that I looked at, there's a huge level of loss in there, but there's also ambiguous loss in there. So when there's parental substance misuse, for example, or when there's emotional or physical neglect, then actually people are experiencing a loss, so experiencing the loss of a parent, even if that parent is physically present, they are psychologically absent for that young person. So I think loss and bereavement is a particularly important missing adverse childhood experience. But there might be others, and we're talking about what the research needs are, and I know it's not an easy thing to do, but I do wonder about whether we should actually ask children what would they see as adverse childhood experiences. So something I'm particularly interested in is looking at bullying. Should bullying be an adverse childhood experience? Should being in care? And the presence of parental separation, which we think of as a really kind of common childhood experience, I think is worthy of further exploration. I wonder if we dismiss it because it is such a common experience, and maybe we need to have a look at that in a bit more detail. So this is a quote from one of the boys in Pullman, and I think that really sums up the importance of bereavement. So this is one boy who had lost 5 people in his life. So, gender. I said I wanted to talk about gender. As I said, it's not possible to conclude anything from my research. The sample is too small, the sample is too skewed. But for me, it has raised some important questions that I think are worthy of exploring a bit further. So, we were discussing a little bit before the break about gender and whether adverse childhood experiences affected the genders differently. I went and looked back at the English study and the kind of Welsh study, and there is a slight tendency towards a higher ACE score among females than there is in males, but it's not consistent. It's not found in all studies, and it tends to be quite a small difference. And when you look at the individual ACE exposure, there are no systematic differences that I could find. I haven't tested it statistically between exposure to the different ACEs. So the only one that seems to predominantly affect females is sexual abuse. That's in all studies, that is definitely an experience that females are more affected by. But in the English study, females were significantly more likely to have experienced 4 of the ACEs, so verbal abuse, sexual abuse, family mental illness, and family alcohol abuse. But there was no significant difference in exposure to the other ACEs between the genders. In the Welsh study, the 2015 one, males were significantly more likely to have experienced verbal and physical abuse, witnessed domestic violence, and experienced the incarceration of a family member. So females in that study were at increased risk of sexual abuse, but there was no difference on the others. So in that study, males had been exposed to more of those ACEs in every single one of them, apart from sexual abuse, or there was no difference between males and females. And I think something we do really need to consider with males, and particularly when it comes to sexual abuse, is underreporting and a lack of disclosure. So I do think in relation to sexual abuse, there may be more males that are exposed to that than we are aware of. So just to set out my stall, I'm going to conclude, and actually from Louise's data I could probably need to rethink this, that exposure to adversity in childhood is broadly similar between males and females. When you looked at our study, there was a significant difference in overall ACE exposure between males and females. So males had been exposed to 3.7 of those adverse childhood experiences, females almost 5. And this isn't actually that unusual when you look at samples of vulnerable populations. So there's a study of adverse childhood experiences in the Kibble population. Almost all studies of people in prison would find that females in these situations are always much more vulnerable, much more victimised than their male counterparts, particularly on this measure of ACE exposure. So does this mean that females are more vulnerable to adversity? They certainly when they come in contact with the system, they certainly have this higher elevated level of adversity. But I am going to suggest that actually it might mean the opposite, and that there's maybe something that serves to protect females to some extent from contact with the justice system, at least in the short term. And some of the bigger ACEs research might help bear that out. One of the studies by Schilling et al. In 2007 suggested that males showed a substantial increase in drug use at exposure to 4 ACEs, and females did not show the same increase in drug use until they had been exposed to 10 ACEs. The ACEs research suggests that males come into in contact with the system at a much lower level of adversity than females do. Okay. Interestingly, I think in our study, males seem to demonstrate higher levels of really common childhood adversity, so parental separation or bereavement. These experiences that, while aren't seen as very positive in your childhood necessarily, they aren't also that uncommon. So when we included bereavement, actually this significant difference between males and females disappeared. So males had experienced a higher rate of bereavement in our sample. It wasn't quite significant, but I do think that's down to the small sample. But when we included bereavement, there was no significant difference in the number of ACEs experienced between males and females. So when we looked at parental bereavement, 13 of the young people in our sample of 130, 13 males had lost a parent, none of the females had lost a parent. Now, there is only a small sample of females in there, but I think that that's part of a pattern. Now, I think it's quite unlikely that males would experience more bereavement in childhood. I don't know about you, but I can't see why a sibling group, if they lose a parent, the males and the females, the boys and the girls in that group would experience that same bereavement. So this is where I suppose I started to think, and where a lot of my questions came in. So my questions are there gender differences in ACE exposure? So as was discussed, the research would suggest that they're broadly similar, although Louise's research is definitely throwing a spanner in the works here. But this might be in relation to the overall ACE exposure, so your ACE score, but it might also be the nature of that exposure. So as I said, I can't see why males would experience more bereavement than females in the population, or why they would experience more parental bereavement, but they are more likely to experience the death of a same-sex parent. So if you're a boy, you are more likely, if you lose a parent, you're more likely to lose your father than you are your mother, because male mortality in that 25 to 44 age or 54 age group is twice as high as it is for females. So if you're a child and you lose a parent, you're more likely to lose your father. So we know that's not the only answer. We've talked a lot about attachment and relationships, and children grow up in all different configurations of families, and secure attachments are the most important thing regardless of the gender of that parent or the makeup of that family. But I do wonder if there's something about the loss of a same-sex caregiver that is particularly important in some way. So we have time. My second question was, are there differences in the way that males and females respond to adversity? So are there factors that make females more resilient in some way? So there might be a genuine difference in resilience. We've heard lots about resilience today. We know, for example, that there's a huge gender gap in help seeking between males and females, because we know that there are lower levels of emotional and mental health literacy among males, there are lower levels of social support networks, and there are also societal and cultural norms about masculinity and what it means to be a man. So a study of adolescents in Queensland found that 30% of young men, of boys, who were interviewed reported that they would not seek help from anyone regarding personal, emotional or distressing problems. And only 6% of females said the same. So there might be this underlying difference in resilience in relation to help seeking and social support. Or it might be that the symptoms of trauma and distress just manifest differently among males and females. We hear lots that females internalise their response to trauma, while males tend to externalise by acting out, so by aggression, by anger, by substance misuse, for example. So it might be this rather than a genuine underlying difference in resilience. There might just be different ways of coping or different ways of getting by. But either way, whether there is a genuine difference or whether it's just a difference in expression, it's quite clear to see how this could lead to a gendered response from services. So you could see how services might respond to females in distress with a kind of emotional, mental health and well-being lens, and for males with a kind of behavioural focus, and which tends to lead to a response from authority, whether that's contact with the criminal justice system or incarceration, for example. So that leads me to my final question about, are there differences in the way that we So whether that's us in society or us as a system, respond to males and females affected by ACEs. So as I said, you can't answer any of that from my research, but this is what my research is making me question. So are we leaving females struggling along, I suppose, just getting by in life, struggling with kind of high levels of loss, bereavement and adversity until they become overwhelmed and end up in the system? But at the same time, are we also punishing and criminalising young men at an even earlier stage because of their expressions of trauma and distress in relation to adversity, loss and bereavement? So as I say, can't prove anything at this stage, but it's my hunch that this explains the kind of gender differences that we see in the criminal justice system. So I think this explains why we see such a high proportion of males in the criminal justice system. But I think it also explains that when we do see females in the criminal justice system, they do tend to be the most highly vulnerable and victimised members of society. So there we go. I will leave it at that.
Thank you, Nina, taking us to that next level of really thinking about those intersections about gender in Nina's case. But I guess for me it triggers off, well, what about race and ethnicity? What about the other intersections that all of us experience? We've thought a little bit about poverty, but just when we look at these high level numbers, they're really useful. But also it's going that step deeper and really exploring those different intersections. And thank you for, I think, as many questions as answers, Nina. But yeah, lots to think about. Thank you.